You or someone you know ever had burning, aching pain in your forearm that makes it hard to do such simple things as shaking hands or turning a doorknob? Do you have fatigue or weakness with gripping or lifting even a cup of coffee, or extreme pain when straightening and extending your wrist and fingers? If so, tennis elbow or lateral epicondylitis may be the culprit. However, despite its name, tennis players make up only a fraction of cases in tennis elbow. A number of people, including painters, construction workers, people that work on computers, and even massage therapists, are commonly affected by this. If this condition goes untreated over time, just like all other itises, it can develop into nerve entrapment of the radial nerve. Now, this radial nerve, when it gets irritated, it is exponentially more painful, sometimes accompanied by numbness, could have tingling, and it can be very long lasting. And as the nerve makes its way down the arm, passing ligaments, diving through muscles and connective tissues, if there's inflammation, especially from repetitive strain over time, it can get trapped by the matrix of connective tissue that your body lays down to heal the area. And big mahalo to the body's healing mechanisms. However, after each time it gets inflamed and the body lays down this healing matrix, eventually it forms scar tissue that has the ability to wrap itself around structures such as nerves and vessels, and this can limit mobility of the nerves. The nerves need to remain flexible, mobile, and super elastic enough to stretch and flex with all of the diverse movements that you have available to you in your arms. And in this video, I want to share with you three mistakes that therapists make when treating this area and assessing this area, and also a Hawaiian healing philosophy of care that could be the answer to achieving lasting relief in this area. You're going to want to watch to the very end to see a magical stretch that can make all the difference towards recovery for your clients and even for yourself if you're experiencing this. I'm Kumujini Ivaleni Nalawai, and I'm here at Ho'omana Spa on the island of Maui. And I gather here with healers, body workers, anyone who loves to learn about Hawaiian teachings of Lomi Lomi, Ho'oponopono, and of course, living in Aloha spirit. We gather right here to wrap the arms of Aloha around the globe. So wherever it is that you're tuning in from, let me know in the comments below so that I know just how far reaching this Aloha is spreading. Okay, I want to talk about these three common mistakes that therapists make when working in the area of the outer elbow or lateral epicondyle. Number one, working too deeply, too quickly in a highly painful area when the pain cycle is on and there's repetitive inflammatory patterning going on. This is not the time to attack the area with a sharp tool and just crush the muscles into submission. In Lomi Lomi, we were taught by Auntie Margaret Machado to love the body. That is completely opposite of the common adage, which is no pain, no gain. In Lomi, we want no pain, no pain. And in Lomi Lomi Hawaiian massage, we want to warm the tissues, work through the layers from light to deep, and work the tissues surrounding the pain. What you want to do is take your inside hand, place your thumb over the wrist, over the top side of the forearm, and your outside hand is going to place right over the last digit of the thumb. You're going to pick 3 to 6 lines and glide, pressing with the outside hand over the thumb from the wrist to the forearm, right over those wrist extensors. Each time you're moving a little bit more laterally. And of course, in Lomi, we always soothe and make nice. Number two, a second common mistake is working on the forearm muscles, but not releasing nearby attachments like above where the brachialis is or below where the supinator is. I call it working the neighborhood. I was taught to work with certain key links, which are located in various areas of the body. These typically are at the neuromuscular junction, which is where the nerves meet the muscle belly. And this can help to unlock compensatory holding patterns that sometimes happen when there's inflammation. This approach can gently reprogram the synergistic relationship between muscles surrounding a joint and ultimately diminish pain, and restore proper movement in the area. And here's how to release two very important keys. Key players in this area are the brachialis, which is located just above the elbow. Really, it's at the crease of the elbow. And also the supinator, which is located just below the elbow and is part of the mechanism that actually rotates the forearm. So watch here and you'll see exactly how we work on this. The brachialis is located just above the elbow joint, flush against this anterior outer humerus or arm bone. We want to work on this by tacking the muscle tendon to the humerus. Then shortening the muscle by flexing the elbow. This further tacks it into place. Then keep that tack as we lengthen or extend the elbow, keeping a firm, broad pressure over the brachialis tendon. This will work on the tendon where there are fewer pain receptors, simulating a contraction so that the receptor in the tendon gets the message that a contraction has happened. And what we know about contractions is that at the end of any contractions, we get relaxation. Only in this case, the brachialis will achieve this without actually putting the client through a painful contraction, especially if the area is inflamed. The outcome is a relaxed brachialis, more movement around the joint, and a release in the area of that lateral epicondyle, where you have many, many different extensors of the forearm and extensors of the wrist, all coming together off of a common attachment. The second key is the supinator, which may be the most important one for radial nerve entrapment. And here's why. The supinator is a muscle that wraps around the head of the radius and is the point where the radial nerve dives through as it passes from the elbow to the wrist. To find the supinator, you can either passively move or ask the client to actively move the forearm from palm being down position to the palm being up while the elbow is bent. If you place your fingers right over the upper outside forearm as you perform this motion of supination, you will feel it spinning the head of the radius, spinning beneath your fingers. Then you know you have the right area. Once you find the head of the radius, have the client start with the palm down, have them turn it up while you, as a therapist, resist active supination. Give gentle resistance through the movement because remember, it's highly sensitive and painful because it has to do with the nerve. Then as you move from the head of the radius to about halfway down the forearm, each time actively resisting as the supinator takes the forearm from palm down to palm up, you'll actually be lengthening the supinator and freeing up more space for that nerve. Finally, once we've released the neighborhood and relaxed the keys around the area, we are ready to free up the radial nerve itself from any place where scar tissue matrix has bound around the nerve, keeping it from moving properly. What you want to do is floss the nerve. Our nerves are meant to be elastic, similar to a rubber band. When they are stretched, they get longer and they get thinner, or their circumference gets less, it shrinks. If we then move it back and forth, it has the potential to break free from that scar tissue restriction for better conductivity and diminished painful symptoms. What we're going to do is radial nerve stretching. The radial nerve comes down underneath the armpit into the brachial plexus.
it comes off and dives into triceps, into anconeus, which are the muscles that are on the back side of the elbow. And then it makes its way underneath a muscle right at the head of the radius, which is the outside bone of the forearm, dives through a muscle called the supinator. From there, it goes down through the extensors of the forearm. It comes down through the anatomical snuff box, which is that spot right here, before it goes into the hand. As it goes into the hand, it basically does all of the sensory to the backside of the hand. So if we want to stretch this nerve, you're going to come into shoulder depression. So the shoulder blade needs to come down. Then the elbow is going to come out and the palm is going to turn in. So the shoulder is coming into what we call internal rotation. You're going to bring the arm back, and it's kind of like you are reaching back to get a baton. So you're going to take your hand back, make a fist, and flex all of your fingers and your wrist. Now, once you're in this position, you are at the most stretched point of that nerve. And now you're going to take your head over to your shoulder. That's going to stretch the nerve and bring it back and back over to the shoulder again and back.
If you paid attention to what you learned in this video, you won't find yourself making any of these mistakes, working too deep too quickly in this very painful area, working on the muscles, but not releasing the surrounding attachments or key links in the neighborhood around the painful area. And finally, flossing the nerve itself to free it up for all of those exciting arm activities that await you. Mahalo, everybody, for tuning in. Hope these were helpful techniques for you to incorporate into your practice. If it was helpful, write helpful in the comments below. And if you want to learn more techniques just like this one and begin your journey with Lomi Lomi or return for more advanced techniques, we're offering our advanced Lomi Lomi training in April, and we would absolutely love to welcome you to Maui for a live retreat. If you're excited about joining us, just write Lomi in the comments below and we will get you everything you need to join us right here on Maui for one of those live retreats. Until then, mahalo to everyone for tuning in and a hui hou. Until next time.